This is a real treat for me to talk to you about Acer Unit. And I'm Deborah Janes. I'm one of the nurses, and for my great privilege, I'm also the ward manager of the Acer Unit, and most people know me as Debs.
My name's Dr. Tim Williams, and I'm a consultant addiction psychiatrist, and I've been working with the drug and alcohol services here in Bristol for over 10 years now.
My name's Claire. I'm one of the charge nurses on Acer Unit, and I've worked here for 6 years.
We're a treatment centre. We enable people to go through medical treatment, but also it's very important when people come to Acer Unit that they feel that it's homely and they feel safe and it's comfortable. We try very much to provide an environment that contains and holds the safe medical side, but also contains the real person-centred side, the therapeutic side. And we do that really well. There's only 2 NHS places like us in this country. And we provide a very unique service for people with hope and opportunity in the treatment system.
Because there's hardly any units in the country now, we have become a more complex service. We can deal with pretty much all addictions.
All sorts of people come to Acer Ward from all sorts of different backgrounds and from different situations. Lots of people have severe mental health problems that need a lot of support, and also physical health problems. So sometimes people have managed to have a really good period of recovery and then they've slipped back and they need the extra help and support. But all are welcome into the Acer community with open arms. And I think we have a really good, healthy balance here, which allows people from with different experiences, different ages, different backgrounds to support each other for the common goal of trying to get closer to their own personal recovery.
We aim for a sort of calm, therapeutic environment where people live in a community.
And we encourage that community atmosphere. So we have peer mentors that come onto the ward and volunteers, and they help us out.
Hello, I'm Sue and I'm a peer supporter here. I did an alcohol detox at Acer Unit 14 months ago and now come back to volunteer.
When you've been referred here by your key worker in the community, then we would ask you to come for a pre-assessment where you'd be seen by nursing staff and the doctor, and we then go through your contract with everything about Acer and everything that we offer you and what we'd expect you as a client to do when you're here.
So if you'd like to follow me, I'll show the unit. So here we go. Okay, so this is the Acer Unit. This is where we walk in. I came here 14 months ago for an alcohol detox, and I'll start to show you around. Before you actually come onto the ward, you have an introductory day. I've never been to a unit like this before, and like a lot of people, I felt, what's it come to? That, you know, I felt so ashamed and frightened and broken. But the lady who is the manager here, is Debs, she is just wonderful. She's just so warm and almost maternal, really, and makes you feel it's okay, we're going to look after you. There's absolutely no condemnation or judgment or severity in any of the staff's faces or attitudes.
We have meetings twice a day to ensure that people are orientated, they're supporting each other.
We also have a smart meeting here, and we have mutual aid come in, AA, NA and CA.
Okay, so this is the room where we have the work groups. I found the work groups essential actually, because, you know, it helped you really think about your recovery outside of here as opposed to just the physical detox in here.
The medication regimes and the medication programs are just a way to stabilise and help people get towards the overall goal of recovery, but it's really that that community helping each other and recovery ethos that's the most important part of the work that the staff team do here at Acer Ward.
This is probably, in the first week, the temple of all service users, because this is where you get your medication. And all service users at various times think that they know more than the doctors. And the staff are lovely, you know, that even when you're not having the official medication, if you're feeling anxious, if you're feeling unhappy, you can talk to somebody, have a one-to-one. There's not sort of, this is your lot and then you're cut off. There's ongoing concerns about how your physical well-being is, which is brilliant.
Because people feel quite unwell when they're detoxing, staff do support people quite a lot. However, we do encourage people to do their own laundry, but we do support people with lots of things.
That's the laundry. Again, it's really part of getting back into self-care, into taking care of yourself a little bit more, because a lot of us were living in pretty awful ways before we came here, and self-care and keeping up with washing and ironing and things like that pretty much fallen by the wayside.
So there is some hard work to do, looking at oneself, looking at the own causes and consequences of their actions and behaviours. But there's also some fun time as well to try and relax.
And in free time, there is activities. We go out for a walk every day. We can do cooking, gardening. So there's lots of other activities that you can take part in if you want to.
Staff will come in and help you bake or cook if you want to. Anyone who's recovering from drug or alcohol addiction will tell you that they like to eat cakes and biscuits. So making those is quite popular. When you're here, you're encouraged to participate if you like. I personally did. I spent a lot of time weeding, and hopefully, you know, people chat and get together and you get to know people, because the worst thing would be to just stay in your room all day. It's not encouraged to sort of ruminate and isolate, because it's probably what we've been doing in, you know, out there. So yeah, so this is the garden, which is lovely, and this is the relaxation room. You can come if you want to just do some colouring and it'll be on your own. I had a visit here from the local priest that comes here, local vicar, and that was in here, and also my own visitors. And if you want to make a phone call, and it's just generally a very peaceful, pleasant space, really.
And we encourage people to do artwork.
This is the wonderful tree. You can call it the tree of life, the tree of recovery, whatever. And when we leave here, we write something on a leaf. You don't have to, just to put on the tree. And it's really inspirational. There's a lot of encouragement for creative things here. And a lot of people haven't had hobbies for a long, long time. You know, my hobby was drinking. So to actually engage in something else that's more creative brings your confidence back, gives you some ideas for when you leave here as to how to pass your time.
There's a gym on Acer wards that can use if people really need to have that physical exercise.
This I actually used, and I'm not a gym person, but I thought, well, you know, it's about doing something different, doing things differently. So I did come in here and worked on the rowing machine and on the bicycle thing. Until I'm not a gym person. And I enjoyed it. I started to understand what people say about exercise making you feel a bit better.
There's also TVs and there's Xboxes and DVDs, so there are all those things as well.
So this is the main lounge, and this is where, as you can see, there's DVDs, television, plenty of books, lots of craft activities as well. So it's a really nice space. A lot of people stay here in the evenings to watch TV together.
So there's a lot of things that we endeavour to do, and we're hoping to develop ourselves and get more resources so that we can actually do more things with people.
In the ward round we have the nursing team there and the junior doctors from the ward, and we invite each of the service users to come in and together as a team we work out the best treatment plan for that individual. All of our treatments and our interventions are correct evidence-based treatments. We are a specialist NHS provider. That means that we can offer the forefront of innovation in the drug and alcohol field, taking on board all the experience from NHS services around the country. We have specific protocols for detoxing from a range of substances. Synthetic cannabinoid receptor agonists, more commonly known as SPICE, other drugs such as ketamine, and that includes novel psychoactive substances, GHB, mephedrone, as well as more traditional things like cocaine and cannabis, which can sometimes be more difficult to access help and support for in other community services. We are able to deal with people with dual diagnosis, people with mental health problems and physical health problems, which coexist with their substance misuse problems, as well as issues that can complicate a detox or reductions such as pregnancy. We can also do new innovations such as high-dose transfers from methadone to buprenorphine. We've successfully detoxed people from these substances and helped them access long-term rehabilitation and recovery. What we do here on Acer Ward is providing that care and support for people with more serious and special issues that can complicate their drug and alcohol use. We can provide innovative and cutting-edge services because we are an NHS provider and because we have the access and resources from the wider NHS network across the UK.
The staff made it fantastic. They really made me feel safe and supported. It opened my mind, it gave me a sense of hope. We're here to look after you, for you to help you turn your life around.
Acer Unit is special because every member of staff who works here actually wants to work here. Having staff and patients who want to work together, it just makes it really special.
The ethos of Acer Unit is love and boundaries.
We are absolutely privileged to have a unit like the Acer Ward in the NHS, and I see it as my absolute goal to ensure that we keep growing and we keep thriving.
That's how I felt. I felt valued as a person. Even though they do this week in, week out, it felt unique and special to me.
It is not just a hospital ward or a unit. We're something very much more than that. There's not another place like it.